Dr. Douglas Robinson, Campbell Podiatry. I'm going to do Shockwave for someone who's got a problem with the insertion of his Achilles cord called the Achilles inserting into the heel bone called the calcaneus. This person has, it's known as insertional calcific Achilles tendinosis. And what that is an enthesiopathy where the tendon inserts into the heel bone. He has inflammation, and he also has a small intrasubstance tear of his Achilles tendon. I treat these conservatively with a machine that's called Shockwave. It's also known as EPAT, and that stands for extracorporeal, meaning outside of the body, pressure activated technology. So what this does by means of pressure and sound waves percussing on the heel, it stimulates his body repair system by stimulating a condition or a physiologic change called angiogenesis. Our blood has growth factors in it to help heal this. So this has been going on for months and months and months. He's a runner. He has not been able to run because of the pain. I got him some heel lifts to go under the liners. That's helped. He's going to continue to wear this throughout the course of treatment so that his tendon isn't tugging on the heel bone as bad. And then he's coming in for a series of treatments using this technology. So let's get into this to start getting him feeling better. So here we go. This is called Shockwave. And this again uses sound and pressure waves to stimulate healing. We've had him put a mark on his heel so I know right where he's having pain. And this is where I'm going to focus this treatment. So once I turn this on, the treatment's less than 5 minutes. It's uncomfortable, but it's not excruciating. And what's nice about this treatment, there is no risk at all. The two things that we don't use this for, if they've got this in their body, is if they've got an infection down here, or they've got any type of a malignancy down here, we don't use Shockwave, or an infection, we don't do that. Okay, turn it off. So notice that we've completed the Shockwave. Notice how red this is. That's the angiogenesis. No, this is more flesh colored. So we've just completed the Shockwave treatment. Usually it's a series of 1 up to 6 treatments. Usually for this condition, they need to at least start with 3. When they have periods when they can't remember if it's left or right, they have days that doesn't hurt at all, then we spread out the visits instead of doing them weekly. So there's no risk to doing this. Typically when you have Shockwave, you don't want to be icing the area or taking anti-inflammatories concurrent with this treatment because it will mitigate the full effect of doing this naturally. Shockwave is partially covered by insurance. There's an office visit, that's for my time, we can bill that to insurance. There's no insurance that covers regenerative treatment for foot or ankle. This is under the umbrella of regenerative treatment. That would be under the guides of doing PRP or mast cells or stem cells or Shockwave. So we have a separate fee for that. Call our office or talk to your doctor what the fee is in aggregate so you know what you're looking. It's not that expensive, and people find that it really helps the majority of people, and it's reported that 80% reduction in pain, not necessarily 80% success, but 80% reduction in significant pain. So if this feels much better, he can resume his running and start getting more and more active. So that's what we do for insertional Achilles tendinosis or Achilles enthesiopathy or any Achilles problem where there's a problem where there's not good blood flow and tendons and ligaments don't have good blood flow. They typically stay kind of stuck in this dilemma of continued discomfort. So that's how we take care of this condition. I'm Dr. Douglas Robinson. Please take care of yourself and each other.